All right, guys. Hello again. Um, Before we get started, we're going to go over some scenarios, some real life first aid scenarios. You should have your answer sheet in front of you that says first aid at the top. Make sure you have that in front of you. I'm going to go through different scenarios. I'll give you a short amount of time after we go through to just jot down how would you treat that, and then we will check our knowledge, okay? So make sure you have the piece of paper in front of you as well as something to write with. All right, first scenario. You are working at a daycare facility in Eagle Grove. A 5-year-old girl walks up to you and says, I fell off the swing. You see that she has a small abrasion on her right elbow. Explain what you would do. All right, so just a refresher, what is a small abrasion? What is an abrasion as compared to laceration or a puncture? There's a difference in the way that we treat based on the wound. All right, let's go ahead and review. So an abrasion, if you remember, is a very superficial injury, doesn't typically have a lot of blood associated with it, but we do worry about the risk of infections when working with abrasions. So think of it as when you skin up your knee following a bike accident or something like that. Okay. I'm going to link us into Mayo Clinic for most of these. This is an excellent resource. As far as online resources go for medical information, they do tend to stay very up to date on the information they provide. So if you're looking for information, I would recommend Mayo Clinic over like WebMD. Okay. So Mayo Clinic recommends, as does our textbook, when we're working with minor cuts and scrapes, we want to make sure we wash our hands first to help avoid risk of infection. I will add gloving as well. When you're working with open wounds or any sort of body fluids, we want to have gloves on to protect us. Stopping the bleeding is an important first step, but with an abrasion, we wouldn't expect a lot of bleeding. So we would move on to cleaning the wound. Soap and water do wonders as far as reducing the risk of infection. Um, and then applying a covering of the wound. It does recommend applying an antibiotic ointment, but that is not part of the first aid that we learned. So we are just focused on stopping the bleeding, cleaning the wound, and covering the wound to prevent infection. All right, scenario 2. After supper, you and your siblings decide to go out for ice cream. On your way to the ice cream shop, you come across an accident. Everyone appears to be okay, but an older gentleman has a laceration on his forearm. What would you do? Give you about 30 to 45 seconds to kind of think about how you would handle this situation and jot down your answers on number 2 on your answer sheet. All right, so what would we do for a laceration? Let's review again. So we had an abrasion in scenario 1, so that's a superficial scraping of the skin. What is a laceration? If you remember from our lecture, our PowerPoint, a laceration is a forceful tearing of the skin tissue, causing a jagged and rough opening or wound opening. With these, we do see more bleeding associated with the laceration as compared to an abrasion. So let's go ahead and review our steps. All right, so if we were to find severe bleeding with this laceration, we would first remove any clothing or debris on the wound. If there's anything large or deeply embedded, remember we do not take that out, we leave it in place. Our first job is to stop the bleeding. remember our steps that we talked about. There's 4 different steps we can take to stop bleeding based on the amount of bleeding. The first step is to apply firm pressure with your hand in a bandage. That constant pressure should make the bleeding stop. If we need further intervention, we can also apply a pressure dressing, which is using constant pressure, but through the use of a bandage binding it. You can also elevate the area of the injury, as well as the next step would be to apply a pressure point. So in the arm, if we had bleeding of the arm, where would our pressure point be? Which artery would we apply direct pressure? It would be our brachial artery. All right, so stopping the bleeding, if the patient were to appear kind of lightheaded or woozy, excuse me, we would also have them sit down and just monitor them for that. All right, scenario 3. You and your brother are helping your parents re-roof your home. Your brother comes up to you and shows you how a nail has punctured through his shoe into his foot. What do you do? What do you do if a nail punctures a foot? Go ahead and jot down your thoughts. All right, so what would we do for a puncture wound with a nail? Um, remember, our puncture wounds are anytime something punctures into the skin. We worry about puncture wounds. One of the things we worry about is risk of infection, specifically tetanus, the risk of tetanus infection. Um, so we would want to monitor or identify the wound on your brother's foot. Excuse me. And assess it for assess the nail to see the state of that nail. Was it rusty? Was it dirty? So when we're taking care of a puncture wound per Mayo Clinic, we're going to obviously first wash our hands. That's very important when we're working with wounds to prevent the risk of infection. We want to apply gentle pressure to the area to stop the bleeding. If the nail is not in it, if the nail is still puncturing into the skin and it's superficial, you can pull it out. If it is lodged in there, embedded, we want to leave it in place. We want to clean the wound with soap and water, remove any debris that easily comes out of the wound. We also want to consider getting medical treatment. The rule of thumb is we get our tetanus booster every 10 years. But if it's been more than 5 years since your most recent tetanus shot, you will typically get a booster if you were to have punctured yourself on a nail or something else that they're worried about the risk of infection with tetanus. All right, number 4. So you and your friend went to the pool yesterday. Today, your friend shows you the blisters they have developed from their sunburn. What do you tell them to do? What's the very first thing we need to identify in this scenario? What type of burn is it? So if he presents with blisters from a sunburn, would it be a superficial burn? Would it be a partial thickness burn or a full thickness burn? Take about 30 seconds to jot down your thoughts on how we would proceed. All right, so if the sunburn presents with blisters, we're going to classify that as a partial thickness burn. Remember, superficial is only affecting the epidermis, the very outer layer. It'll be red and tender, but it won't have blisters associated with it. So how do we treat our sunburns? Most of the treatment for a sunburn Oh, that's the wrong one. We don't want severe bleeding. Most of the treatment for sunburns is going to be done at home. If I can pull up sunburn first aid. Um, we really only need to seek medical attention for sunburn if the sunburn begins to be severe with blisters and covers a large portion of your body. So not just blisters on your shoulder. If the sunburn's accompanied with a high fever, headache, pain, confusion, we might worry about the risk of infection. But for this sunburn that we're talking about, this is just probably a mild partial thickness burn. We would recommend that they increase their fluid intake, put lotions or creams on it, such as aloe vera, to reduce the pain, over-the-counter pain medication um, for the pain that's associated with it, and just to monitor it. It's going to take a few days for this to heal on its own. We also want to leave those blisters intact as well to reduce the risk of infection. All right. Let's work on some triaging, okay? So you're on your weekend camping trip. Your sister trips and falls on a hike you are taking. You suspect a broken ankle and she is in lots of pain. She is showing signs of shock. What should you do, or what should you do first, okay? So before we start, think about what are your signs and symptoms of shock? What did we talk about, or what did the textbook talk about as far as signs of shock? Like, how are we identifying? Okay. And so if we have our sister where she's showing signs of shock, but she also probably has a broken ankle and she's in lots of pain. How do we triage her? What are we going to treat first? Now, go ahead and take a moment, jot down what you would treat first and how you would treat it, what steps you would take. I'll give you about 30 seconds. All right, so the first thing we're going to treat is those potential of shock. Shock is a life-threatening situation, so we want to try to control or try to prevent the shock from happening. Or if shock does happen, we're going to provide first aid. So first aid, when we're thinking shock, remember our signs and symptoms of shock can vary depending on what's causing it, but oftentimes they include cool, clammy skin, pale coloring of the skin, cyanotic or blue tinged on the lips or fingernails. Their pulse is going to be quick and weak. Breathing is going to be rapid and probably shallow. Nausea, vomiting, weakness, dizziness, changes in mental status. This is a medical emergency. We do want to get help as soon as possible. We can elevate the legs and feet slightly and have that person lay down. We can try to keep them still, try to stay with them and stay calm, and then provide CPR if they are to become unconscious. So that's going to be our first step in triaging. We're not worried about the broken ankle if shock is a concern. All right, just a couple more. All right, so scenario 6. While babysitting, you find that the 2-year-old boy has gotten under the sink in the bathroom and drank some Windex. What should you do? What would you do first? I'll give you guys about 20 seconds to kind of review this. This is definitely something that my 2-year-old boy would do. So what would you do if you were babysitting a 2-year-old and they drank some Windex? All right, the very first step in this would not be calling the parent or inducing vomiting or doing any measures. The first step would be to get a hold of poison control. This is a website. I just Googled it and came upon a website for poison control. They'll triage you here. But if you Google also just poison control, doesn't want me to leave. It thinks there's something going on. There's the phone number right there. They're open 24 hours a day. If you do not have the poison control number on there or you forget to look it up, 911 can also assist you. We also want to make sure when medical help does arrive, if medical help is coming, that we can tell the people what was consumed, about what time it was consumed. If you have an idea of how much, that'll come in handy. All right, last one. You are spending time with your grandfather when you begin to notice changes in his behavior. You suspect he is having a stroke. What do you do? What do you do? Jot down how you would manage if you believe that somebody is having a stroke. All right, and once you've done that, I want you to remember, look, or think back to when we talked about strokes and the FAST acronym. Let's review what FAST means. So FAST is going to help us identify a stroke when it's happening. The F stands for face. So ask the victim or suspected or person who you suspect is having a stroke to smile, and one side of the face is going to be drooping compared to the other side. A stands for arm. Ask that person to raise their arms in front of them. One will raise up, the other one's going to kind of drift to the side or not be able to raise it at all. Stands for speech. This is probably your first indication or what made you notice that their behavior was changing. This means their speech is slurred or they're not making any sense. And T stands for time. It is imperative to get help as soon as possible. The sooner we get them the help, the more chances we have of reversing the brain damage that is being done. All right. Real quick, little crash review. Make sure you put your name on that answer sheet that you were filling out. Place it in the box number 3. I have assigned you a Kahoot in Google Classroom. So review that on your own. You can use Chromebooks if they're available. You can use your cell phone if you don't have a Chromebook, as well as a study guide that I will post to Google Classroom to just prepare you for the exam. If you have not finished your workbook, you can spend a little bit of time doing that. They are due tomorrow, so whatever you do not finish on your workbook, take it home tonight, complete it. That way you can turn it in tomorrow. And I will see you all tomorrow.